Alright guys, we're going to run through the cardiac supply and vessel anatomy notes real fast so we can get through this quick. And here we go. You should be looking at the notes titled Cardiac Supply and Vessel Anatomy for the outline that goes with this. Okay, so the cardiac anatomy is basically dealing with the blood vessels that give circulation, give nutrients and oxygen to the heart muscle itself. As we've talked about in class before, the blood flow that goes through the heart doesn't directly feed the heart with the nutrients and oxygen that it needs. So there's blood vessels that go around the heart that help to do that. Okay, the first one in your notes is a left anterior descending, or the LAD. It's also called the anterior interventricular artery because it is mainly going to work with the septums. It's going to deal with the ventricles mostly. If you look at where the path is, that means where this blood flow goes, where the vessel goes down the heart, and it's going to go anterior, which means front, along the septum. And remember, the septum is the middle part of the heart that divides one side from the other. And it's going to supply the anterior left and right ventricles with the blood flow that it needs. So that means that it's going to cover the blood flow, or the nutrients that come from that are going to cover most of the front parts of the ventricles. There's a picture to show you where it is, so you can see here this piece that runs right down the front. The circumflex branch is another one. It's also called the circumflex artery, and it gives the lateral left ventricle and posterior left ventricle the blood flow that it needs. So it's going to cover the remaining portions of the left ventricle. And here you can see a little branch of it going off around the side. Then we have the right posterior descending, which is part of the right coronary artery, and it's also called the posterior interventricular artery because it's going to deal with ventricles as well, and it supplies the posterior, which, remember, that means the back of the right ventricle. And you can see that one here running down kind of the center. This is the back view of the heart. Then we have the marginal artery that gives the rest of the ventricle, the lateral right ventricle, the coverage that it needs. You can see that guy right there. Okay, so when we talk about blood vessel anatomy, so we're just talking about any general blood vessel here. It has a hollow core in the middle, kind of like the hole in the middle of a donut, and that's called the lumen. The next layer, or the layer that's closest to the lumen, is called the tunica intima. And we should be doing a labeling sheet in class pretty soon over this to help you kind of get the picture in your brain. I know it's a little more difficult just going with the words, but we will get there for sure. Anyway, the innermost layer is the tunica intima. It's made of endothelium, which is an epithelial tissue, really, really super thin. If you remember what simple squamous tissue looked like, that was the one that looked like a fried egg. That's what it's going to be made of, and it's really good for diffusion, so it's good that it's that middle layer. Then we have the tunica media. If you remember Spanish, or if you've taken Spanish, media means middle, and so that should be fairly easy for those of you who know Spanish to remember. It's made out of elastic connective tissue, which makes it stretchy, and smooth muscle, which allows it to contract as it needs to. It is the thickest layer because it's made out of these two things. Then we have the tunica externa. If you just think external, that might help you remember that it's the outside part. It's made of fibrous connective tissue, which is really good at helping maintain the structure of the vessel, and also smooth muscle, and that fibrous connective tissue helps to make it really strong. So there's going to be collagen tissue in there, and I know you guys remember collagen tissue makes anything that it's involved with really, really strong. Okay, so comparing the differences between arteries and veins, we've got the same layering pattern for both. So both have intima, media, and externa, but if you look at a vein, it's got a thinner muscular layer than the artery does, because the veins are simply just return blood flow to the heart. The arteries actually pump, kind of like the heart does, and so they need that thicker muscular layer to allow them to do that. Here is a picture to kind of show you how the valves work in the veins. So let's see, valves are there to predict blood flow, to help blood flow only go in one direction. When they're open, it allows the blood to go in the direction that it needs to, and then when the blood tries to flow backwards, it kind of snaps that blood valve closed, so it helps to keep the blood flowing back to the heart. Okay, this is going to have to go on the back side of your note sheet. I know we're kind of skipping around a little bit. We haven't done the capillaries part yet, but just kind of roll with me here. So go on over to the back and copy this table down, and I'm just going to talk you through it real quick. We're comparing arteries and veins. When you look at arteries, they're more elastic or more stretchy than veins are because they have to be able to accommodate a larger quantity of blood coming from the heart. They're more muscular because they have to be able to contract but push the blood flow through. They have thicker walls for the same reason because they have more muscle. Your blood pressure is higher in your arteries because that blood is constantly being shoved through there. Veins are really just kind of like straws bringing the blood back to your heart. Now they have valves in them, which arteries don't, so that makes them a little more complex, I guess, than just straws. And then the lumen is larger in the veins than it is in the arteries. So make sure that you know the differences between those two. That looks good, doesn't it? As people get older, this happens. This is kind of a severe instance or a severe picture, but varicose veins happen when the valves in the veins are not able to operate the way they used to anymore. They kind of stretch out and weaken, and it causes blood to collect in that area because it's able to flow back a little bit, and it doesn't look very pretty. You can have treatment for this. A lot of the times it doesn't cause problems, but it can. It can cause some pain and some circulation issues if it's not maintained very well. Okay, so flip back over to the front. Let's finish those notes up. Capillaries are made of endothelium only, which we talked about was made out of simple squamous tissue, very good at diffusion, and that's what we want in capillaries. They're so thick that only one red blood cell can pass through at a time. Super, super, super thin. And we've got lots of oxygen and carbon dioxide flip-flop going there. So on your note sheet, it has 5 spots for you to list things down. Make sure that you have endothelium only, you have tunica intima, you have simple squamous tissue, you have that only one red blood cell can pass through at a time, and you have that gas and nutrient exchange happens here. You probably want to also note there that they're near almost every cell in your body, and that excludes epidermis or cartilage. And we've talked in class about how goofy people like your teacher, when they were younger, used to stick pins through the ends of their fingers, and you didn't have any bleeding happen then, and that's because capillaries don't cover all the way up to the surface of your skin. That is it.